A few days ago, NDTV, in partnership with MST, hosted the conclave Together Against HPV, the fight against cervical cancer, which brought together the best minds from the government, science, policy, and civil society. Let's take a look at the key moments and insights from the discussion where leaders united to explore ways to eliminate cervical cancer through vaccination, awareness, and timely screening.
At MSD, we are deeply committed to this cause. Over the past years, we have worked with numerous partners, influencers, physicians, to bring the conversation around prevention of HPV-related diseases and cancers like cervical cancer to the forefront.
We have a special recorded message from the Honorable Governor of Uttar Pradesh, Anandiben Patel.
भारत में महिलाओं की कैंसर से होने वाली मृत्यु का दूसरा प्रमुख कारण सर्वाइकल कैंसर है। विश्व स्तर पर इस बीमारी से होने वाली कुल मौतों लगभग 25% भारत में होती है। इसी परिप्रेक्ष्य में राजभवन उत्तर प्रदेश ने वर्ष 2021 में महिलाओं एवं बालिकाओं के स्वास्थ्य संरक्षण के लिए एक अनूठी मुहिम की शुरुआत की। इस अभियान का उद्देश्य था सर्वाइकल कैंसर की रोकथाम के लिए निःशुल्क टीकाकरण और व्यापक जन जागरूकता। सर्वाइकल कैंसर पूरी तरह रोका जा सकता है। हमें केवल अपनी बेटियों को समय पर HPV वैक्सीन दिलवानी है। यही उनके जीवन की और हमारे समाज की सबसे बड़ी सुरक्षा है। आइए हम सब मिलकर संकल्प लें कि भारत को सर्वाइकल कैंसर मुक्त बनाएंगे।
Well, joining us now is a key parliamentarian whose leadership is shaping policy on the ground. He's currently heading the Parliamentary Committee on Petitions. Please welcome Mr. Narayan Das Gupta, Member of Parliament, Rajya Sabha.
Friends, as you know, cervical cancer is the most common cancer among women in India. It is not merely a medical challenge, but is a matter of social justice, public health, human dignity. The incidence of cervical cancer is higher in rural areas when compared to cities. The figures paint an alarming picture of the situation before us. There is a need for intensive public awareness campaigns to dispel doubts, fear, and misinformation, and routine cervical screenings, encourage parental participation, and reach every household. Friends, the vaccination is essential for prevention and screening for early detection.
I was joined by a passionate advocate for women's health and wellness who had been instrumental in raising awareness about critical issues affecting women. To begin with, Renuka ji, when we talk about preventive health, it's a societal one, especially as women. I think somewhere we forget ourselves. You're busy juggling between different roles. I want to ask you, how do you think, like you said, different stakeholders coming together, going back to that point, how do you think different stakeholders can come together to encourage women to focus on preventive well-being, even something very critical like vaccination and screening?
The status of women in society, to be able to recognize and for a woman to be enabled to articulate her needs and her health, which is the lowest in priority in our society. So unless you empower women to be able to say, I need help, I need to be checked, I want this examination done, it's going to be very hard.
If you could give one call to action for everyone in this room, as well as women themselves, on preventive health, what would that one call to action be?
Well, it is the can-do spirit that all of us collectively can make that change. Next year, when you have a meeting like this, we've got to be able to see improved statistics.
Absolutely.
And it's not an overnight thing, I concede to that. There's huge resistance to any such thing. But we can do it because you're not just doing some token, you are actually saving a life.
We move to the first panel. We are in this together, collaborations and partnerships. Because beating cervical cancer isn't a solo mission. It needs partnerships between government, private sector, schools, parents, and the healthcare system.
Over the past years, the awareness around HPV prevention has increased considerably. But from here, what is the next chapter of our journey to reduce the burden of cervical cancer look like? If I can begin with you.
We must realize as a country that about 150 countries have already introduced this vaccine. But as a country, what we must also realize is if globally there is a 90, 70, 90 strategy for cervical cancer, and countries have to reach this 90% vaccination coverage by 2030, global average is still 60. If you look at the speed with which India has delivered on many vaccination campaigns, 2 billion COVID recently, even if we begin now, it's not late.
What lessons from past large-scale immunization programs or efforts can guide us in making a universal vaccination program effective and sustainable?
For making any immunization program successful, first what is required is awareness about the particular disease or particular vaccine, whether that particular vaccine is available or not, affordable or not, and then we should know about the disease, how that particular vaccination can prevent the disease.
Now, looking ahead, what kind of partnerships will be most critical to ensure long-term impact in reducing HPV-related cancers and diseases in India?
If we are talking about partnership, one is, where the government doesn't go, civil society goes. So I think we really need to bring civil society on board at this point of time. And particularly because this vaccination is for adolescent and the youth population. So I think we must engage something called as the youth networks. There are across the country, there are a number of youth networks. They have been very effective during the COVID campaigns. I think for HPV vaccination, we must engage, civil society and particularly the adolescent and the youth network. And then the most important and the crucial is the engagement of the education department. I again repeat, because unless we engage, we develop the confidence of the teachers, and there are captive population in the school. I think it will going to be a real win-win situation in terms of bringing partnership with the education department and with the civil society.
Next, we discussed how prevention is the most powerful tool in modern medicine, and by taking small timely actions like early screenings to vaccines, we can have a huge impact and lead to one less cancer case. Dr. Agarwal, I would like to begin with you first. When we talk about prevention, through vaccines as well as screenings, which is very basic, it's often overlooked until it's too late and we realize, why didn't we do this before? How can we really bring about a shift in the mindsets of people when it comes to prevention and taking that step really in the beginning?
What we have in India is a very kind of curative mindset or a breakdown maintenance kind of mindset, where when something goes wrong, we will go to the hospital and seek treatment. But when it comes to preventive health, either we don't see the direct benefits immediately, which is why we cannot think in terms of monetary terms that if I do this today, I'm saving myself 10 years of suffering. We don't see that. And particularly so for cervical cancer, because as a clinician, I will tell you there's a very long period from someone getting infected with the HPV to actually developing cancer. It might be as long as 10 years. So for the patient, if they don't see immediate benefits, or for any person where they think that today if I take this, tomorrow I will be fine, that tomorrow is 10 years later. It's the preventive maintenance you need to invest in, not the breakdown maintenance. I mean, the age-old adage that prevention is better than cure or a stitch in time saves 9, they're all very valid for something like cancer.
Areez, if I can come to you, but talking about steps now that we know where we are going wrong and when we delay, what can happen. How can employers as well as organizations promote cancer prevention and early detection among their employees? How can this be integrated, if I could ask you, more like a workplace well-being kind of a thing?
Number one is, of course, increase awareness, because I think there is a significant delta when it comes to the importance of prevention, especially when it comes to women-related health. And I think Dr. Renuka also did mention that women tend to assume that role of caregiver because it's a society burden that they carry, that their own health needs are often neglected. So yes, awareness is very critical, and that's where the whole importance of change behavior communication comes in, right? There has to be significant amount of work that the industry needs to put in. Of course, we need to put in to ensure that there is effective communication, and then to further that, beyond that, how do we make the whole process of provisioning of vaccinations simple and uncomplicated for organizations?
Sangeeta ji, if I can ask you, hearing it directly, from a survivor can be powerful. We have, we have our audience here. If you can tell us how your experience has impacted your perspective on prevention, your perspective of health and wellness, and what message would you like to share with all of us here?
It's not easy to deal with this disease at all. So when I started with the symptoms, which was just mild spotting, and I ignored it, and then it increased. And that is when I went to the doctor. By then, it had already set in, and it was at a slightly higher stage. And after that, I underwent hysterectomy. My repeat pap smear showed return of cervical cancer, and obviously it was more aggressive by then. And then I underwent the treatments. Now, the point that I want to bring about here is that your problem does not end with just the treatments. So the day I came to know about the HPV vaccine, my daughters were given, and all the girls in our family were given the vaccine.
All of our panelists have spoken about awareness. So if we started in a curriculum or, make that conversation very easy from the beginning, so that, like Dr. Agarwal said, we don't have to look how to start a conversation.
We do a lot of campaigns, poster making, and last 5 years, consciously we are doing this cervical cancer campaign. And I would be telling you that whole staff of my school are vaccinated. We did that campaign, and children from 9 to 14, and especially 15 to 18, even children have taken. We have primary health center, our neighbor, CGHS. We spoke to them, coordinated with them. So it was, of course, not mandatory, optional. So 69% of my adolescent girls and few boys also, I would be proud to say that equally I'm orienting them, and they are taking this vaccine.
Well,
so
I think
they
we need to have a round of applause. 69% of the school, thank you. We need schools
and
like
whole
Ideal.
staff, whole staff.
Yes, to take that initiative. So I think that's really, really well done. Time for a short break. We'll be right back with more on Together Against HPV, the fight against cervical cancer. While often associated with cervical cancer in women, HPV can cause a range of cancers and diseases in all genders. Our next panel explored why a gender-neutral or universal approach to HPV vaccination isn't just equitable, it's essential.
So, Dr. Gupta, if I start with you, HPV doesn't discriminate, yet vaccination programs have largely focused on girls. Why is it important to shift towards a more gender-neutral approach?
It is very important not to only stress on girls, because up till now, I think the name cervical cancer, the name that we have been talking about, cervical cancer, it is giving a misconception that it cannot occur in boys. And also that now we should just stress more on the name HPV instead of cervical cancer, so that we can also cover the boys.
Also, I think making it gender neutral probably takes away that stigma attached to it, that anyone can get it. Dr. Ghosh, beyond cervical cancer, HPV can cause a range of diseases in men and women.
Absolutely.
How can making this risk visible across genders help drive public acceptance of universal vaccination?
The gender-neutral HPV vaccination is critical. There is enough evidence today through research of the burden of cancers happening in males because of HPV virus. I think it is critical for us to understand that leaving out the boys from an opportunity that exists to prevent cancer in them is a whole ethical issue. So therefore, gender-neutral vaccination is critical for moving forward as a public health impact.
So HPV is often framed as a girls' or a women's issue. How do we shift the narrative within medical communities and also the masses?
So number one, we need to go beyond the cervical cancer vaccine to a cancer vaccine. Lastly, do remember that at least we have something like a screening for cervical cancer, but we have nothing for men screening.
That needs
and
to be
believe
changed,
in
of
equity
course.
and inclusivity.
Absolutely. Why leave the men out? Cervical cancer is a major public health challenge. Then making it gender neutral, at least the vaccination, the prevention gender neutral, will it strengthen our fight against it?
The two things that are needed in that sustainable program, it has to be sustained. It's not like a one-time vaccination for a few girls. Sustainable and very high coverage. If we take it to a coverage of 80-90%, which will be fantastic, then we will have herd immunity as well. But when you have herd immunity, the boys may not need to be vaccinated at all. So we can save resources. What I'm trying to say is that when it comes to scale for the government, it's very important that they do a good planning. A lot of things are in place. I think we have checked all the boxes over the years, and many who have worked in this space for a long time, we have checked all the boxes. It's just a matter of intent. I think that sometimes somebody will just jump up and say, let's just do it. Everything is in place.
Prevention begins with awareness, and awareness grows stronger when trusted voices lead the conversation. Whether it's healthcare professionals, community leaders, educators, or public figures, influential voices have the power to break stigma, build trust, and inspire action. How can we encourage more open conversation about women's health, including, of course, I'm talking about HPV, cervical cancer, but per se women's health?
For women, it's always been taboo about talking about them, their problems, their health. And with platforms like these, I think it's a great start. The conversations have already begun, and that is why we're here to push it forward.
How can these platforms like this help raise something as basic as awareness on HPV?
It's voices like ours who have platforms, who go out and tell others that it's really important for me to, talk about it so much more now, which I anyways am doing.
How would you encourage women to prioritize their health? And what message would you like to convey to your audience about this specific issue?
I feel that one needs to look at health in a much more holistic manner. It has to be a regulated, conscious effort of a yearly checkups, getting screenings done, spreading awareness about it so that your loved ones or people that you can influence can also benefit from the kind of knowledge you have about it. And it is our responsibility as people who are from fashion, Bollywood, influencers, because
Masses want to listen.
The youth of today is actually really influenced by us.
The next panel was Busting Myths, Building Trust, that focused on clearing the fog of doubt and ensuring that accurate evidence-based information leads the conversation.
That is a common myth that the HPV vaccine is only for girls, and that is not true.
I want to make people aware there is a type of head and neck cancer called oropharyngeal cancers. And that cancer is also caused by HPV. And we say it responds well. So there is nothing to hide about that.
Thank you for highlighting that.
HPV can cause oropharyngeal cancer, and it responds well to all the three types of treatment. So it's meant for both.
If you had a minute to convince a vaccine-hesitant parent, what would your pitch be?
When we talk of, HPV vaccine, it must be taken by both girls and boys, but on a priority basis for girls because they are more vulnerable for reproductive tract cancers, to name first with the cervical cancer, which the name goes synonymously with that. So now is the time when you must protect your child against cervical cancer.
So I'm going to ask them that have you protected your child from other vaccine preventable diseases like polio, like tuberculosis, you have done a BCG.
Coronavirus.
Yeah, so they will say, yeah, we have been very particular about it and very prompt about it. Then my question goes, did you now then think about taking your daughter for cervical cancer prevention? I'm not going to put up as cervical cancer. I'm going to put up as HPV related, diseases prevention.
6 out of 100 people in our country actually get this kind of cancer. If your child takes it at the right age group, which is 9 to 14, there is an 80 to 90% chance that they will be protected from it.
Also, to make a stronger point, I do that I've vaccinated my boys already. And since I've vaccinated my boys, you should vaccinate your daughter, definitely.
Thank you so much for watching, and please join us in this fight against cervical cancer.